I would imagine it's so static. In reality, it is a dynamic factor. That each one of such groups, which we call now in Western terms a functional circuit, a regulating circuit, is a dynamic element. It's full of dynamic. And in each one of these are included lots of organs. You see it in this chart. You see that there are sense organs included. We have only listed here very few organs. Not all what is included in such a group, in such a functional circuit. Only to give you an impression that there are differentiations. For example, I listed here the different sinuses. You know, we have the sinuses of the frontal sinus frontalis. This is connected, for example, with the group of incisors, kidney bladder. But we have the sinus sphenoid sinus. The sphenoid sinus again is connected with the canine teeth, liver gallbladder. The ethmoid sinus is correlated with large intestine lung group, with this element. And so we have the maxillary, the biggest sinus. And this is again connected to stomach spleen meridians, with this group. And the fifth group, the heart, small intestine, there's no sinus, but all the cells, it's like a sinus system in the mastoid. The cell system, it's very similar to the ethmoid cell system. The cell system in the mastoid belonging to the ear, that is connected with heart and small intestine. It's very important to know when treating children with acute otitis, for example. So we have to learn that it's really a differentiation in 5 different factors. Again, we have these 5 factors, for example, for the different tonsils. Tonsils are the differentiation of lymphatic tissue in our field, dentistry and ENT. We can differentiate the tonsils in the midline is a tonsillar pharyngia, adenoids, as we call it in childhood, which very often are operated in childhood. They are situated in the midline, where the uvula, you know the uvula, and backward of the uvula, upward and backward of the uvula, there are the adenoids, which very often they operate with children. And these, again, are connected with the system of incisors and kidney bladder. This one is situated more to the middle. And canine teeth are again correlated with another tonsils, with the palatinal tonsils. And so we can differentiate to the tonsillus lingualis, the tonsils of the tongue, and the tonsils or the lymphatic tissue in the larynx, and the lymphatic tissue in the region of the Eustachian tube. You find it here in the chart. But again, 5 groups of lymphatic tonsils or tissues. And so we have the sense organs. We have 5 sense organs: the ears, the eyes, the mouth, the nose, and the tongue. And again, each one of these 5 groups is connected with one of our sense organs. You find it in the chart. Maybe that's not totally, you don't find it for all, or you can write there's oropharynx, that means lips and mouth. And for heart, you can write tongue in your chart. But tongue, it's very important to know, means not the taste, it means the ability to speak, to express yourself by words, by singing, whatever it is. It's the ability to communicate. That is the heart and small intestines connection with the sense organ, that's the tongue. And liver, it's here, kidney, ears, inside, lung, intestine, no, yes. So they only have this word in the heart, small intestine, tongue.
Dr. Gleditsch, could you just once again review the area of the tonsils as they're distributed?
Yeah, good. The tonsils are not in this chart, I see. Yes.
Could you sort of hold it up to us as you're pointing at, because we can't see it.
Yes. No, it's better?
No, not for me, for the audience.
Oh yeah, was it? Good. So we came up to the, it was clear with the incisor teeth and with the canine teeth, the palatinate. Now the lung and small, the lung and large intestine are connected with the lymphatic tissue at the tube, at the tuber stachys. Dr. Voll calls it tonsilla tubaris.
At the opening of the eustachian. At the opening of the eustachian.
Yeah, eustachian tube. So eustachian tube. You can write lymphatic tissue of eustachian tube. It's a good question because many of our patients during the last years have problems in this area where you don't know, is it a problem with the ear? So you say there's a little numbness here, you can't hear, it's a little painful in this area, it could be trouble with the PNG, it could be trouble with the ear, and you don't find anything. The dentist has no idea what it is, and I look at the eardrum, nothing in it, and I look at the tonsils, nothing, but if you palpate, you find that the area retromolar upper jaw is painful, and if you have testings by fall and crumb and this, you find troubles in most cases in large intestine. And these troubles in large intestine have their projection again in the lymphatic tissue, which is nearby this eustachian tube. And if it is swollen a little, you will feel it in the ear. The numbness is a little, as it's a, yeah, it's like a lock in it. And a little bad feeling sometimes in the PNG region. Some patients have a little noise in the ear. And so, yeah, a little tinnitus sometimes. Right. And so, we think again for the syndrome of, what's it, name?
Meniere.
Yes, Meniere syndrome, but the other one which is connected with the PNG. Kasten syndrome. But it's not. It's a lymphatic reaction. It's no Kosten syndrome, it's no Meniere, it's a normally lymphatic reaction, and if you treat the lymphatic points, we will talk about in the afternoon, and you try to convince the patient to change his food, his nutrition, it disappears. And this is so important. All the other methods, if you begin with a split, with a denture, if you have injections, it helps for some time, but it's not the deepest cause. The deepest cause in so many cases is the lymphatic trouble, and the lymphatic trouble is in this area in our field as well as in the field of the large intestines. And so the nutrition is really one of the most important factors. So we go on. So it was an element of lung, the medians of lung connected with the ethmoid, and now we have pancreas and stomach connected with the larynx, lymphatic tissue. The tissue of the larynx, Dr. Voll calls it the larynx tonsils, but there are no tonsils in this way, but the lymphatic tissue. And the fifth group is again the heart group, and the heart, we just mentioned that the sense organ connected with the heart is the tongue, and so it's a tissue, the lymphatic tissue at the base of the tongue. We call it the tonsilla lingualis. This tonsilla lingualis is connected with the fifth group, with the heart group. Okay?
Thank you.
Fine. There's then some more, for example, in this chart about elbow and shoulder. You will find it in the group of the heart and small intestine. You who have learned a little about acupuncture before, you will know, for example, that shoulder complaints are not only connected with the small intestine, but as well with the large intestine, as well as with the triple heater. For you who have not been trained so much in acupuncture, take it as it is now. I can only say for this who are a little more engaged in acupuncture, that the shoulder really has three sides we have to realize. The front side, is the large intestine side. The upper or medium is a triple heater correlation. And the back side of the shoulder is the small intestine. And so you can control also the movements, which of the movements are more painful or more restrictive. So you can know which of the meridians is the primary cause. But for us it is so nice, since in the oral cavity, these meridians are linked together, are agglomerated at a very little space, the retromolar space again. And at the retromolar space may be that these three meridian groups, large intestine, triple heater, small intestine, backside, that they meet. They are meshed again. Three functional circuits are meshed in this area. And therefore, our possibility to treat it in the oral cavity is the best. Another doctor who had to do needle here, needle there, needle there. And a very important rule in acupuncture is, and this is so fascinating for me, as I had done the neurotherapy in so many years before. The neurotherapy tries to get the area that is painful. Shoulder complaint, oh, I look, where's the area, where's the joint, where's the nerves, and I give injection either to the nerves or within the joint, again with procaine or xylocaine, this is a technique, or I give injections in the segment. It works. But more elegant, more gentle for the patient is to work by distant points. And this is the science of acupuncture, that you can treat shoulder complaints from different parts of the body without touching the area that is painful, inflamed, and which may be in such an acute state of irritation and inflammation that it's better not to touch it. A very acute state of lumbar, of sciatica, of shoulder complaints is so well be treated by acupuncture because you can either treat it by points in the oral cavity or points in the auricle or distant points according to bodily acupuncture. For the shoulder, for example, in this area we have distant points for the shoulder. And if they're a very acute state, I have the first try in the oral cavity. If it doesn't work, I go here to this area. If it doesn't work, I go to the auricle. So we have 3, sometimes 4 groups of points that we can use as distant points. Distant points, that means they're a long way from the inflamed and irritated area, and if it works, it's wonderful. If it doesn't work, we have to get another idea, but in many cases it really works. And our points in the oral cavity, they are, if you think of the functions and organs of the body, they are distant points. Moreover, for the lower jaw, are the points in the upper jaw distant points. Moreover, for the right side, are the left side points again distant points. Look at the chart. You had an extraction and a very bad situation, a dry socket. You had a big problem with your patient. It is swollen after the extraction or after the operation of a cyst or the operation of an infected tooth. And it's so much swollen, for example, here in the area of the upper wisdom teeth, left side. What to do? You can't give an injection in this area. You could have radiation and you could give remedies, but you can do something. You can give the patient, for example, an acupuncture point on the same area in the lower jaw, the corresponding area in the lower jaw. Or you can do it on the other side, the corresponding area you operated, but on the right side. You can understand what it is. I will give you another explanation. We have learned that patients that are amputated,
amputees.
Yeah. I just, during the last 2 years, was as a consultant in the pain management of the university clinic in Munich, and they very often have very hard pain conditions with patients. I remember of a lady who had been operated here because of a traffic accident. She first had her leg, but she had the osteomyelitis. You know osteomyelitis? Mm-hmm. And it was push and pass over months. And the doctors tried all kinds of remedies and other possibilities, but it was not possible to cure her. And at last, they decided to amputate. And so she lost her, I think it was beneath the knee. She was amputated. And after this operation, she had such a severe pain that she couldn't sleep. And when I was asked what I would do as an acupuncturist, I asked her again, could you explain to me where this pain is situated? And now is a wonderful answer of this patient. She said to me, yes, it is a very spot where the pus came out of the osteomyelitis all the time before. So I said, yes, but it doesn't all fine, it's amputated. Yes, but I feel it there. I feel it there. It's 1 hand beyond the knee, but this one, this was amputated, but she could say it. So I said, give me your other foot. We will try to get the point on the other foot. And so she took it, it might be here. And I took my needle, again the technique of the dabbing needle, and I felt this area on the right foot, the left foot amputated, and at a special area she cried. She said, that's the point, that's the point. I gave her an injection as a point, and the pain never came again. So you have to learn what is on the right side has a corresponding area on the left side. And if you have troubles after an extraction, after operation, wisdom tooth, impacted, whatever it is, and if you can't treat it on this side because of swelling, because of pain, whatever it is, or patient can't open, better you do it on the other side. Okay? You have the chance to help the patient by these laws. That are rules, these are laws. That we have interconnections between left and right, between up and down, over upper jaw and lower jaw. It's
time for lunch.
Time for lunch? But I think this was a good story to finish with. Is it?
Yes.
Oh, very good story. Thank you. So it's not my doubt, but I feel I sent some more slides and everything to him that you can go on with such groups, and I would be very happy to hear if you may have, for example, another meeting in 2-3 months for giving your informations, your experiences to each other. I told about it's very difficult to have such new experiences alone. But if you can share, if you have a chairman, you know what I mean. So it's better for you if any one of you again organizes it, give a telephone call, and you will meet and you will discuss it. And I would be very happy if it would be so, and if you would succeed in it.
Good. Very good.
Fine. Now we begin this demonstration. So again, the first we thought about is a palpation. And before I begin this palpation, good. I will teach you a special trigger point or acupuncture point area, which for me has become very helpful for all in our field. Dentistry and ENT, all what you see in our facial area, if it is a trouble of chronic pain conditions or whatever it is for a longer period of time, or if the patient is in a psychological trouble, any way, he used to be painful in this area here. And if you palpate this area, please be not too gentle. You need some pressure in this area. And if you look at the books, acupuncture books, they write, it's, for example, one point in the line between the mammals. So you would look only for one point, and you wouldn't get it. I like to have my palpation in a line, in the midline, from a point which may be more here, near the sternum, the sternum edge here, we call it the ugulum. From the ugulum down to the sapid. Sapid? Exactly. Here it is. And please include, if necessary, this point in your treatment. You can have a little injection at this point. Sometimes it helps with a massage. We have learned, and I've learned it by the dentists in Germany, that they said to me, if this point is very sensitive, here it's a little sensitive, but it is sensitive in a high degree, and you have an appointment with your patient for this day for a big operation, or preparation for a bridge, or whatever it is, something what stresses your patients in a high degree, you will have bad results, because the patient is not in a good condition. This point is really a point which you can call an indicator point. He gives you a hint that the patient is in a good somatic as well psychological condition or not. And especially this area is connected with our feet. And if this is not a good condition, you can have the best operation, you can have the best preparation, but you may get a dry socket, or you may get other troubles which are not caused by your work, but by the bad condition of your patient. I've seen, for example, with a good friend to ours from Hanover, a lady of about 50 years. She had a roots apex operation. In a time I knew she was very upset with her husband. They talked about divorce and all that, and they had just begun to build a house. A very, very bad situation, you understand. And she had lost her job, and at that time she had this operation. And she got a lot of pain. And so she, after 3-4 months, came to a dental surgeon, and he looked at the X-ray and said, oh, I will do it better. They have another operation. And he operated it once more, and now the pain was increasing incredibly. She has a very bad trigeminous neuralgia. What was the cause? The psychological background, it was the worst months of her life, and the operation was done. Divorce, a new house, lost her job. Nobody had the idea of it, but ask your patient, is there something? Or ask this point. This point will give you the answer what it is. The next one, it was a second tooth that was operated. This lady had lots of trouble with her urogenital tract here. She had been operated 3-4 months before by a gynecologist and she was not cured here. And at this time she had another operation at the second tooth. You see again, we have to learn these connections. We have to ask our patients so that we get good results, for it's not the method we do, is not our operation, but it's the constitution and the special situation of this patient at this day. And we control it by these points, for example, and there are some more points here in the infraclavicular region here. You can palpate it. You can palpate it hard again, not too gently. If it's very painful, we had yesterday one of our patients was so sensitive to this area. It's a lymphatic area. If it's sensitive in a high degree, you can be sure that there are lymphatic problems in our feet. It can be pharyngeals, it can be the tonsils, it can be the teeth, but think of these points too. And sometimes these points are more situated to the midline. That is either in the ugulum, the cranial edge of the sternum here in the midline, ugulum, or more situated bilaterally about one finger beneath the midline. It's the region of the sternoclavicular joints. You have a heart pressure here and here. Sometimes you find it very sensitive. Again, that is it's manifesting lymphatic trouble in our feet. You can treat it first, or you can give the patient some lymphatic remedies, the lymphatic cream in Germany to get, I will send you the cream. And you can treat it also from other points, but think of this area here, infraclavicular, right and left, ugulum, right and left, and the sternum, midline, here is this area, down to the sacrum. And if there's a painful area, better to treat it, but you need not necessarily have it injected with a deep needle or acupuncture applied with a long needle. Have a superficial bubble. In most cases, it's enough. And you have no problem.
At the spot that it's tender? Right at the spot that it's tender.
It's, if I would explain it in terms of acupuncture, there are many causes. In one of these causes, I will tell you, this point is a point we call a master point or alarm point, signalizing point for the circulation meridian. But on the other hand, for the triple heater, it's, for this I have not heard about the acupuncture, I do very quickly. The triple is three, it has three levels. The level of orogenital, the level of digestion, and the level of respiration. And for the level of respiration, there's a special point in this level again for the triple heater. And we have learned that our environmental conditions, most toxifications we are suffering of is our respiratory system. And we have learned, for example, in Germany, that in these parts of Germany where the pollution is worse, there are the most cases of bronchitis. We have big statistics now that the relation between bronchitis, especially chronic bronchitis, and pollution of the air, that's a direct link between. So if we are painful here in this air, it can also be caused by the pollution of the air we all are suffering of, especially if you are living in Manhattan, and it can be. But it is at the same time for the lung impression that all what is connected with lung and large intestine has a very big psychological background. Paracelsus, in his writings, write about this special element or group. He had other names for it, but it is the same field again. He writes that everything that is connected in this is much more psychological and should be cured by psychotherapy than by somatic therapy. So that we can learn many bronchitis, sinusitis troubles, they really need a little psychological treatment too, not only somatic. And therefore again, think of this point, psychological troubles, pollution troubles, circulation troubles, they can manifest here. And the diamond point, as I call it, it's a thymus point, thymus point. The thymus point is this point for energy, the central point of energy in the body. Dr. Diamond has found out it, and I agree totally that the energy level of the body can be tested by this point, either by this kinesiologist test, muscle test, also in many cases by palpating. I will agree that this test is the more, yes, test. This test may be more insure, but in many cases you find it already here by palpating. So do it. Now the next palpation we do is in the oral cavity. You can do it with your fingers. Here for demonstration I use these little helps because I have no possibility here to wash my hands or whatever it is. So we look first inside the mouth, have an inspection if there is any ulcus, any after, or a problem of a denture or something. It's perfect. Oh, fine. Thanks. And now you can begin in the upper jaw, lower jaw. I begin here in the lower jaw, and you see the technique of palpating. I have the thumb outside, the other finger inside, and the finger are pressing against each other, and I go from the one ear to the next ear like a little massage. Massage like this, one finger gliding against the other finger, and the lip is in the middle of the fingers. Very simple done. Maybe that one of you will develop a much better technique. Think of this tea friend of Munich. He had a better technique in the mouth maybe than mine. I was only the beginner, but I'm sure after some years you have a much better method. Only to inspire you to do it.
Do you feel sensitivity in your lip when you do that?
Did it hurt? Where most?
Mostly right
On the mandibular? Which here it was. You see, my normal finger is on the
External oblique.
on the axial, on the oblique, and in the ascending mandible, the outer rim of it. Here it is. Little, but not so much. Left side again. Here it is. You see? Oh. Once more. Here. Inside or outside?
It's more closer to the middle.
It's the area of the canine teeth and first premolar. Where is it most? Here it is. Canine teeth. Is it?
You could feel it.
And it is little, if one of you will have interpretation too, it's like a little indulation here. You feel? Here it is. Like a little bubble. And now we go on here, again this area. Now we have the patient. Either in your position, you have the patient in this position as dentist. You can palpate again in this way. Think of it, if you palpate in the lip area here or there, it's best to open the lip as far as possible that you can get it between your fingers. For you, it's maybe very good to have this palpation done in this way. For me, as an ENT doctor, I have this patient sitting. So that it's difficult to stand here and to change again. So I have learned for my use, I palpate by this way that I go up, I have to come over the vestibular fold by my palpation. So I have to go up to this bone feeling here. Now I am no more in the vestibular, I have kept this area. And so I can palpate here, near the nose, canine, premolar, molar, and here in between. The creaminess, it's a pain. Now it's a tuberosity, all the area pain. Left side again, incisors, but high up, you see, at pressure, cranially. I have to take it up cranially. Again, premolars, molar teeth, again the mimic reaction, this pain. You can have little palpation sometimes on the lingual side in the lower jaw, but not possible with each patient because of the gag reflex. It's nothing. We can have a control of his movements in the cervical spine. The normal movement is that the patient would touch the shoulder by his ear. Did you get it? So he has, you see, he has to, it's difficult. Then to have the movement back, and you can press my fingers? Here, okay. And to the side? Okay, fine. What's your problem? What's your problem?
I can't, my arm, that's just,
Left arm.
well, both. But
Both
this is chronic, this is acute. This just happened last week.
That's it. Okay, so you had an accident in ski. Was it?
Yes.
Yeah. So if it's an accident, I could have a control on the left ear if there is a shoulder point.
Okay.
Yes. There's a shoulder point in the ear, in the oral ear. It's very sensitive, you see. We can control the other ear.
Controls the left small
You see the difference? Very hard palpating now. Now, this here, we will not palpate once more. That's it.
It's fine.
But, so we have two possibilities. We can treat it in the retromolar space. We can treat it also, if it wouldn't be enough, by this ear point. Another time maybe, we can have a look at the foot area. If there's some pain here.
Yes, right there.
Here.
Right there.
Here.
On the medial side.
Here, inside, here.
No, here. No, here.
More inside. Oh, yeah.
Yes. Yes. I'm fine.
So you see, we have these all are distant points. I didn't look at the shoulder itself. Maybe that we would find here points too. Sometimes it's necessary to give a treatment to this area too. But I used to do it at the last, as I have done with all distant points. Mouth or ear or feet, whatever it is. And before the patient leaves my practice, I have a control at this area, and if they have a little bubble on this point, okay. But all the other points are of more importance than the local point.
Right. Dr. Gleditsch, in all other types of acupuncture, ear acupuncture, body acupuncture, we use solid needles, fine needles.
Yeah.
Why is it necessary to use hollow needles and inject something in oral acupuncture?
In oral acupuncture, you see, we can't have sticking the needle. The patient would swallow them. And so we have learned that it's better to give little injections. But on the other hand, the injection is as well done with a very, very little liquid. And in many cases better and with a lot of liquid. And it is better done very superficially than in a deep injection. And this is a new experience for us in acupuncture. For bodily acupuncture means needles deep, in many cases deep, and having this tai chi with turning needle, and that it gets a feeling in direction of the meridian. That is the body acupuncture. Oral acupuncture has taught us a new idea, that it is the point itself that gives change.
Does it make much difference what you inject? Really?
What I inject? You mean if I inject
Physiological source?
physiological?
Or a low
Yes.
percentage of-
I had the same problems, and I was very critical, so that for nearly 1 year, my practice didn't use anesthetic. I said, I will control myself. Is it the anesthetic or is it the point? And so for 10 or 11 months, I not used an anesthetic for this point. Natrium saline 0.9, the physiological or a homeopathic remedy, but never anesthetic. And I had seen during this 10, 11 months, I had the same results as later and before.
Physiological salt solution.
It works. It really works. It was very important because many of my German friends, they said, what you do is neurotherapy. According to Huneke, you give injections with procaine, with xylocaine, and that is the fact. And I said, no, it is the point. So I had to prove it if it's a reality. And after this time of 10, 11 months, I was sure it's more the point than the remedy. Okay?
What about a homeopathic remedy?
Yes, and if you are familiar with homeopathic and the remedies, you can use them according to our chart. For example, if you have found points in the area, again, of the K90s, connected with liver, gallbladder, and you know, for example, lycopodium or some remedies very good for liver, you can give a homeopathic injection in the K9 area with the lips. It works.
Do you find it working more effectively than physiological agents?
I have the feeling that it is better. But as long as we have not a big statistic about it, nobody would believe in it. So have your own experience. But again, the point is the primary. The second may be what we inject. But the point, as we call it, the very point gives us the best result. And as I yesterday have learned from Dr. Diamond, we have also to think of that the needle, if we take it out or in, if it is verted in the right direction, maybe that you can talk little only about this little speciality when I have that. I think it would be very important, for I was, to be honest, very critical about it. I didn't believe in it. But you have convinced me yesterday. I used to be very critical of all what I do. But I think it's the best way, for when a critical man is convinced, he is convinced for all his day. Isn't it? Other people, they are so very much engaged in the beginning and but the latter began. But if I, as a critical man, am convinced, I can go on my same way. I keep my line. I keep my direction.
What size needle do you use?
Yeah, the size of the needles. there's a problem for, I have seen you have not the same needles as we have here. If you use your capsule, you have your wonderful fine dental needles. In Germany, we have, for example, this one. You can see the size. You have others.
Louder.
There's 25. I don't think it's 25.
That's not fine, 25 gauge, is it?
I think they are better one now. You will have better needles. Another,
These are 25.
it's again a dental needle. And this is a very fine. I like it very much.
What's the thickness?
30?
You can have a look at it.
30 gauge. 30 gauge.
Yeah.
This is the,
But it seems to me if you use physiological salt solution, you need an aspirating syringe. You can't use the copyable syringe that we use. Routine dentistry.
Yes, this is a problem.
Yeah.
So if you use the physiological method.
isn't that a,
Okay, thanks, very good question.
isn't that
So-
an aspirating syringe? I think that's
Yeah.
aspirating.
This is the one you can aspirate.
Huh?
This is the German one. You may have the same one. This, for example,
It pulls out the thing. Yeah, that's aspirating.
Yeah, I haven't used it.
these are the needles I use most in my practice. I will give you this.
We have your attention just for a second.
This needle, which I now put on the thing, I will send round to you, but this is my favorite needle. It has precise this volume and this length I need.
7/8.
Yeah, I think, but I haven't seen the same here.
7/8.
It's
25 gauge 7/8.
7/8.
It's the same? I think it's similar in this one. You can send it around and have a look at it.
Would you
I
use
see.
a finer needle if you had a good one available?
Yeah,
You'd be happier with a
I am happy with the finer needle. Thanks.
25.
Thanks, good question. The finer the needle, the better the work you do. Now we begin. We will have a little cellophane for it. So we have it. This might be take off your pen.
Twice as physiological salt solution in the box. You can't use the aspirating syringe. The
Now I will show you the dipping technique. It is difficult to demonstrate it in the oral cavity. If there are questions, please give the questions to the auditor. That we all have it.
On the physiologic solution,
Yeah.
does that have phenol in it?
Does it?
Does it have any phenol in it?
Ventilated, it's ventilated.
Phenylated?
No. So look at the sternum area. I once more will try to find the area. More down is it? Here it is. You can fix your other finger if you like to do. And now I demonstrate you what is a dabbing technique. I have it very tangentially. Normal acupuncture is to put the needle directly. Patients don't like it. And I have learned it's a better way if I take it in this way. Very gentle dabbing. And now I see if there's any erection at the skin. You see here at the top. You see? You have seen the little reaction, and the point was open. Did you feel it?
I'm just impressed.
And now we infiltrate here. It's like to come in an empty place. It's a reality that many of the acupuncture points and areas, they are like, can we say empty? That is a word, hole inside. And the word in Chinese for acupuncture point is foramen. If you translate it, foramen, that's a hole. They didn't talk about points, they did talk about holes. And I really imagine that are holes. They are waiting to be treated. to be filled up or whatever it
Are
is.
you adding more now, or are you just,
Yeah.
oh, you're still adding more?
Yeah, we have difficulties with this. Let's take it out again. That's it. Now we have control. It's gone? Not totally?
Not totally.
Not totally. Very important that we have again the control and have another try. Does it hurt?
Mm-hmm.
There's no resistance in this kid here. It's so weak. So I give some more drops. And you can't hurt anything in this area. You know there's a bone in the depths, and you can't do anything that could happen there. Something you could be afraid of, but now another dabbing for control it, to control it. It's gone?
Just a little bit.
Just a little bit. Okay, is it? So I need some more drops.
Come back in 6 months. Blood pressure.
Don't go swimming.
Yeah.
Is it the same for women too? This is great for retail patients.
Come back.
Not the back of your shirt there, right?
Again?
But still just a small one.
Steady. Now I feel it with my needle that there's quite another resistance, you see? Wait a moment. Okay. You see that now the needle doesn't more fall in or is like attracted as it was before. Now it's more resistance. Now I can stop, I think. Okay? You can have the needle sitting as it is usually in acupuncture, but as you have done an injection, you can also take off it. Whatever you like. Take off it in. Now we go on is with the points inside. I begin with the right side. Now look here. I used to have a little angle in the needle for about how many degrees? Maybe. Ah, yeah, you have seen it. You will remember. And now the next is. Will you please stand here and please?
I can hold.
Yeah.
Yeah, it's fine. You just tell me where you want me to be.
So now I go with my finger into the sensitive area. It's not yet the right one. Here it is. Here I feel it. I don't press now, but it was this point, isn't it? And now I go with the needle under my fingertip. And now I say to the patient, please close the mouth, but not totally. Close more, close more. And breathe deeply. And this was also the technique. I have already injected.
Did you find the
Six
point, or did you just?
Did you feel anything?
When you're hard to find again.
The palpation by the normal is a needle. It's very, usually I have the next point now. Did you feel it?
Yeah.
For the second point, I change now the point. 1, 2, 3 points. This was the second one. You see, I draw it out a little, and there's again the next point. And my finger leads the needle. The fingertip. For a dentist, it's no problem. For the medical doctors, they have problems in this area. For a dentist, it's so normal, it's so very simple. And look here, the mouth might be more closed. More closed, more, much more. A little more. Fine. I think that's the best. There's no tension now in the muscles, and the jaw and everything is very relaxed. This was the area on the right side. I had 3 points, and now the palpation again. Control, it's like a massage, and we have the control if there's any pain left. Is it? Quite a little?
No, just a little.
This area or this
I
area?
have no handle.
More to the mandible.
Like that.
And there was, in the beginning was a pain here. This is still there. This is the mandible. Do you remember the slide we had?
Yes.
It's between. It's not the lower jaw, it's not the upper jaw, it's between in this area here. It's painful.
Is that the cervical spine area?
Yes, cervical spine area, but more cranially into the ascendant mandibular. And now I have the point. I have no lamp, I'm sorry, but we try to get it. I have now the little dabbing needle in this area. If you get that, we give a reaction. At this point now we have some drops. very little only. Some few drops, no more. And I give a massage again. I am very hard with my finger and palpating massage. So you have a very good control. And this is another very important thing. Patients used to say to me, I don't like your finger and palpating, but injecting is nice. So if you are hard and palpating, patients accept it because they didn't see the needle. But if you inject, and you are very gentle with the injection, better in this way than the way.
Are you rubbing where you injected?
Yeah.
Or next to it? Right where you injected?
Yeah. Right in here. So we have a little more point, but it's very little now.
Does the shoulder bother?
We can wait and now first we go to the left side. The movement, okay?
Better. This is the chronic one, this is 30%. How about the other?
The first now is the left side, and then we have a control on the right side again. So that keeps it. Here's the point. You feel it? Here's it. It's near the wisdom's tooth area, not retromolar so much. Again, don't. Yeah, fine. Breathe deeply. And if you can realize, try to get the same rhythm in breathing with your patients sometimes. For every treatment you do, you will be so much attuned with your patient. If you say to the patient, breathe deeply, you look, oh yes, now he's inspiring, and you do the same. You are relaxed, the patient is relaxed, and you are attuned to each other. It's very good. It's nearly gone. That's this area.
At least a 50% improvement.
Let's say it was injected.
But it's better, it's not complete.
Not complete. As I described to you, and now it's a problem how to find the other problem. Sometimes it works from the mouth, sometimes we have to need other points, but we have to try now in the mouth again. It is finished. Now I am on the tuberositas, on the ninth tooth area. No more wisdom's tooth. First injection was wisdom's tooth area. Now I have the ninth tooth area, and I will try to get this point. Again, fine. Breathe deeply. Fine.
Do you put half of the material in?
Some pain here?
Over the arm.
Look at this.
There's about 80% improvement. There's still some discomfort on the mesial part here.
And this is a point we may have at last. Yes?
But much, this thing is really good.
Yeah. And you can do it as dentist, but don't talk about acupuncture. Do it. And be glad if you have helped your patient and you can have a little better fee for your patient, but don't write. A German dentist, a friend of mine, who has done acupuncture many years, he write in one of his bills, see a bill in this, yeah, he write treatment of sciatica. And the insurance went to the justice, because he as a dentist had treated sciatica. Write what you have done with your feet, and you can have a little better price for it. But don't write lumbar gear or shoulder complaints. Write what is in your feet. You can write periodontitis or whatever you like. You have your feet enough a diagnosis to set in the bill. It's true. Fine in the mouth, trigeminus neuralgia. You can write all these diagnoses. I write in my bills 4 or 5 diagnoses. So the insurance can't say anything. They can control my diagnosis. I have functional diagnoses, and there are 5. Right? Now we have the control on the right side again. There's a point still there. You find? It's not gone. It's again the ninth tooth area very distally. you will find it much better with your lamp. I have to do it now without lamp. It's gone? Here it is. Now it's little more palette to the palette side. Palette again?
Yes.
Okay. Now once more.
You can direct traffic now.
Yeah. You can have pitch with the hand. You see what is this? To control?
This one got better too.
That's right. This is. Yeah.
This one got better too.
Yeah.
That last one was on the palpable
Yeah.
section?
Yeah.
of the-
Yes. You see, it's very important to treat both sides. It harmonizes.
What? Or do this Monday?
You're gonna use it Monday?
I'm going to use it Sunday.
My finger
Makes no difference.
Oh, we worship this. Cool.
How long will this last? Is this, you see,
Cure.
the cure? I mean, like, is this forever and ever?
That's not too much improved. So here we have to treat the points of the lower jaw. But it may be too much for today, is it?
No, keep going. If you like, I would like to be the patient.
This is fun.
As long as you don't do my toe. Diamond did my toe once and it never again.
Now, again, the dabbing technique. Better with the needle without the angle. So, I look at the area of the 9-tooth field, and now the fingers here on the lip again, rested, and now I only dab with the needle at any special point in this area. Not so much. Where it is? The needle did not give. You see? There was another mimic reaction, and in the same moment the needle dropped. The needle was at the right place, I hope. Okay. Now the other side again. Can you see? No reaction, very little. Just a little. Now to the lingual side. Little. Again. Close a little. Fine.
What you really need is some intraoral length.
Control here again. So? So.
What's the minute?
See? Okay? Okay? And if you have problems with the joints or with the cervical spine,
You'd have to, I wish you guys could be in my body. This, right in this particular spot was really extremely painful. When you did the last injection on the lateral side, I could feel this go away.
on this side point,
Yeah.
this is acupuncture. This is like magic. But we have to learn that everything is interconnected. So now we finish with this. But you were a very, very good patient. Thank you.
Thank you.
Before you calculate the lower capillary, the transcript point, you just do the lower jaw.
The lower jaw.
Yeah.
Yes, we palpated the lower jaw, and in the lower jaw there were 2 points.
Front area.
The front area, the premolar area.
Right.
Come here. The control. Only for controlling.
In your experience,
Thanks for your. I forgot it. It was on the right side, was it? Left side. It was this point here.
Yes.
It was here. The canine piece in the left, I remember. What is it? Still there. Still there, thanks. What do we do? Then Barbara? Go ahead. Thanks. Thank you. That was it?
In your experience, how long does that last? How long does the treatment last in terms of your experience?
It depends. It's so different. For example, he had no trauma, acute trauma. And this acute trauma can be cured normally totally. If it is a chronic pain, as here it is, so the chronic pain has a background, and the background in shoulder complaints is connected with the meridians, large intestine, small intestine, fibrillator. But if I hear 2 times intestine, large, small, I have to think of digestion. I have to think of nutrition. I have to control, for example, these points here. These are the points of the large intestine meridian, and the most sensitive areas is here. So I have to ask him if he likes to eat sweets or other things which would not, the bowels. Yes, it is. So in these cases, I try to convince the patient that he has to change his food, his nutrition. For he would have had some improvement with his pain condition and with his shoulder movements, but it may come again, and he has to do something by his own. And there are several factors, but this factor, which is very important for the patient and for the change of the life, in most cases, is nutrition. It's a hard factor. And I have learned, if we talk about nutrition, that if you say to a patient, finish with all sweets, oh, no more ice cream, oh, no more cake, oh, no more, what is it, pudding, oh, no more. There's so many, many things. Marmalade. Think of the many soft drinks, what do you call them? In Coca-Cola is lots of sugar. In all the fruit drinks, there can be so lots of sugar. Yes, and so I used to say to my patient, if you let the one, you have to take another one. If you have a child, and this child, instead of playing with a doll, takes knife and fork to play with, take it away. It can't play with knife. But you have to fetch a doll and to give the girl again the doll to play with, or a car with the pot. It's the same here. If I say place that all the sweets, I have to give them the idea that there are many other foods you like. You have to think of what you like. There's so many wonderful things.
Substitutes.
Yes, substitute. You have to substitute. You have to lead the patient to an alternative thinking. That he really thinks, oh, now I go to a special shop. You have been in Dallmayr in Munich. You have a special shop where you can get the finest salads I ever seen anywhere. From all countries, from France and from Italy and whatever. Take some money. It may cost a little extra, why not? But you have to be a man who is not only a, what do you call it, an abstinence person, who does not eat, and each time you are sitting for a meal, again, without sugar, I don't like it. You have thinking alternative. You have to take your food and nutrition as happy as before. And that's your task, how to overcome. He can give some advice, but the patient has to work on it. And most it's a problem of the wife to help overcome it. If it's a lady patient, okay, but if it's a husband, they have to get the wife too and to convince her. For she is an active person in cooking and in shopping and everything, is it? Now we have to cook. It's very little, but there's something here.
Lower down.
No, don't.
In the restroom, right there.
Yes. The patient leads my finger to the very point. It's fantastic. Many patients do it. And now I have the needle in this area. You can see the dabbing needle. If we wait, what happens? There it is. Then here it is. Very near, but not yet. As it was not so painful, it can be that you have not such a strong reaction at this time. Doesn't matter. Not yet. Here. Here it is. Now it was. Okay. See?
It sort of falls in, is that what you're saying?
Thumbs up, sir. It's enough. Okay. Now again the massage. Finished. And think of it that this area, it was a canine tooth area, according to Fall, connected with liver gallbladder, according to kinesiology and to the doctor of Munich, I told you. Also, no, it was not. No, this older one who died 2 years ago, who says that the canine teeth are connected to the heart. And think of it also if you treat each other, colleagues or so, each tension in this area, I learned by another patient. He was a chef of a sanatorium for heart disease. He had told his patient, he has taught them to massage by this technique, to take this part of the thumb and have every morning here massage all over the chest, in the sternal area, besides the sternum, and here below the clavicular. And if you feel a very hard tension, you know you are not in such a good condition. Have some more sports, or have some more holidays, or some relaxation. And if you are well there, you will work hard. It's important for our professions. We need some control. We don't register when we are stressed. Sometimes we are under stress, instead we go on. But if you do it morning, I do it after shaving, every morning, I have a control here. So sometimes, what did you do? I feel so much pain here again. And then I think, oh, I had a very hard day yesterday and it was some problem. And so I have my massage and the next day can be together. Or I go in the forest, have my jogging or anything, the next day is better. You can control it that you really avoid a heart attack. If you are weak here, you will never get a heart attack. And if you are no problem here in this line, you are really in good condition. You can control yourself. I think it's so important. We have no other way to control it. There's no blood test to give you, I say, a good information about it. There's nothing other. You can control it here.
Dr. Gleditsch, are you saying that the point that you inject is slight resistance, or in order to just evidence the pain? In other words, you're aiming for a particular point, which is
The particular point.
The particular point which is exhibiting the painful response.
Yeah. There are both factors in it. It's a factor that it's more painful than touching the point, striking the point. It's really more painful. And because it is more painful, this reaction of saying yes or here or the mimic reaction, but it's the same spot. When you touch it, you have the feeling there's less resistance. Less as if the needle would go in a little channel. Therefore I said it's a foramina, so like a hole. Like if it would be a hole and the needle is going inside, as it was a non-invasive method. Non-invasive.
Non-invasive. That tissue permits the needle to come.
Thanks. You will be a much better lecture next time. So, another demonstration, another patient we have to treat.
I think Larry had a problem. He just had some dentistry done yesterday and had a vital exposure. And it was capped with calcium hydroxide. He's feeling some discomfort there.
Oh yeah.
Seemed like an interesting thing to look at.
Fine. I know. Try to get out of here. I have enough of this. If you are interested to have a palpation by yourself or by your neighbor, please, I will only keep some for me here for our demonstration, but all the others you can now need for your own control and palpation of the colleague. We have the patient is allowed to say to the patient?
Yeah. And I have an exposure on November 1 yesterday.
Yesterday. Exception.
A cough exposure. And when I run, I have a very short energy. And so I need air.
Since this or
No.
Chronic. that's right.
a chronic gut. So they would do it with each of your treatments that you ask the patient for his condition. It's very important to have it, to know it what it is. Again, we have the patient in the sternum area. There. You can begin here in the uvulum again and go down. I think it's okay. You can't think of me?
He said for women, he said he wants to know how you stand with that.
Oh yeah.
For women. So he said he can't wait.
Here. It's not so much again, but it is. And I think we might have this point again.
There's control.
Yeah. We control the cervical spine. It's not so straight the right side. See? Right side has a little problem. It's okay. Okay again, and back side, okay. Fine, it's okay. So, another palpation I did not mention is the palpation of the yaw angle. Here is this area. Right side, left side?
More on the right.
More on the right, but it depends on the treatment here. But if you have a very sensitive palpating here in the yaw angle area, think again of it that you can treat it as a lymphatic trouble, lymphatic condition by these points. Either in the midline here, sternum, or beside sternum, sternoclavicular region, or if it doesn't work here, you can go to the 7th cervical spine. Sometimes more to the 6th, sometimes a little down of the 7th, but normally it is the 7th cervical spine.
You turn them around?
Yeah, you do. Will you just sit again? Be careful, be careful. Right. If you have the 7th cervical, it's a little difficult to say which is the 7th. You can have an experience if the head is reflexed, the 6th cervical spine disappears. It goes in the depths, and the 7th remains. The 7th remains on the spot where it had been before. That remains, so that is the 7th. Once more again, this disappears. If it goes like in the depths, it is the 6th one, not the 7th one. So you have to control in which level you are working. And another problem is that the sensitivity when palpating in this area is not so high. So it's better if you suggest it may be necessary to treat here, you take your knee. And you have your dabbing needle here. You can do it. As long as I have. Okay. And if the patient is treated here, look at the shoulders and the back. That's not in tension. That everything is without tension. Wonderful. That you have a fine and relaxed back here. And now again, the midline, the processi spinosi, and now we have the needle again in this. You see it. Tangentially, the finger is like a feather.
Finger rest.
Yeah, finger rest on it. And now you have the dabbing needle going up this direction, looking if there's any. I think it's very little here. No, not necessary. And if you have such a little irritation of the tissue as here, it's stimulating. As we know that this area here, this area, and the same on the front side, is a very active lymphatic trigger area. You can trigger the lymphatic and the immune system by these points. And also if you didn't stick in a needle, this little irritation is a triggering of the immune system and the lymphatic system. There was 200 years ago or 150 years ago a German techniker. He was not a doctor, medical doctor. He built a little machine. This machine was built of about 40 needles on a plane. and only to push these needles by a special, and to get a very big part of the body hurt by many needle sticks. And by this method, so many people were cured. There was a time, maybe 100, 150 years ago, when they were sailing all over the oceans, and it was the time of the infections that so many of the seamen died. That, what is the infection?
Vitamin C.
No, which was a diet of pest.
Typhus.
Typhus in this time. They had no doctor to sit the sailing boat. But all boats from all countries, they had this apparatus at the time. It was English boat, French boat, South American boat. They bought one such machine. And if one was very severe sick, they only pushed this needle here and there, and the patient were bleeding all over the back and all over the front side. But many survived.
Survive the treatment or the disease?
They could only compare this boat, this had not treated in this way. This is the only way. They have no other method to compare. But they had seen that boats without this machine, very few of the matroses arrived at the next harbor, but this who were treated with this machine, they had a better chance to overcome. It is really so crazy, isn't it? But the simple method can stimulate our immune and lymphatic system.
Can you use Lympherol? Is that the lymph material that you use?
Yeah. So we do it again on the concept. Have you a cluster to do? One cluster? Okay. Here it is. Okay. I think it's more important we will have this point treated. It's no more related. Yeah. Good. Okay. Please stay here. You're not so too symmetrical. The needle doesn't drop, you see? So, again, there's an irritation here. Again, the same place. Finish. No more. And now we look inside.
It was very slightly more right at that point, but it was just,
Yeah. The palpation inside. You can do it symmetrically, both sides, left and right, or one side first. Look at here. Okay? It's again the canine area. Here's nothing. Here's nothing. Very good. Here? No. The upper jaw. Look at this. It's painful here. And this.
in the fold.
In the fold here. And now it's really painful here. Okay. But this is it. Right. This way. You okay? Yes, you can. Yes, sometimes. No hurry. Okay, so we do it either near the wound, here, so? Yeah.
Okay.
All we could do
Right
is
over the custom. Either there or out of the custom, where those are rather equal. Other.
now we have the chance because it is painful in this area. Is it here?
No, you were pushing harder before. Really.
So we can do it once more, left side, and the same for the right side. Is it different or not? Good enough. Good. Not so important. Again, the needle, and now I try to get it more in the retromolar space. Here it is. You can see things that you can imagine. I think it's not very clear. Close the mouth. Breathe deeply. We will not use so much treatment here because of his diabetic troubles.
When you said here it is, and you were palpating, you felt a depression, he elicited no response, but you said here it is. What did you feel?
Yes, some very good patients think. For some patients have a very strong reaction. You see it, you hear it. And other patients
I
have
didn't notice the reaction.
He was a very, very little reaction, I think. Very little reaction. You learn to register also a very little reaction. But for demonstration, it's better have a patient with a very strong reaction so that you all can see it. But in this case,
You felt the reaction on his part.
I
I said,
you feel something that the patient gives a little resistance. Something, it's a little movement in the neck region, is a movement of the head or whatever it is. It's a kind of ejecting your finger. It can be so soft and you feel it. Dentists used to be so sensitive with their fingers. You feel such a little ejection of your fingers that the patient says to you, I don't like it. You feel it. And this is again the point. Also if the patient gives no verbal reaction, not a very strong mimical reaction, a grimace or so, you feel that as if you would push away with the finger. And so you have the point again, or the area. Then you can dab it and find the very area. Now I have the point in the lower jaw, because here I wouldn't do so much. It had been treated yesterday, and so we let it here only with a very little point in the retromolar area, and I have more my treatment now in the area of the contrary jaw, the lower jaw, and I hope you can see it. We do the same again in the ninth tooth area with the dabbing needle. If you find any area which gives an reaction or the needle is falling in this special teeth, not so much. It's very little reaction, isn't it? Not so much. It was no mimical reaction, you see. Just the needle that had no resistance, and therefore I chose this point. Again, if the needle is in the point, we can have the mouth more closed. It's better for the patient, better for the breathing, and now we can do it without any hurry. The patient is without tension. Fine? Good. Finish. And again the massage of the bubble. Okay? Now we have the control here. See? We could do it before. Now it comes here very fine to the side. It was the worst side. This side was better before.
Yeah.
But this side, you remember, this side was worse. Fine.
Do you do it on the other side, or is that not
I think
necessary?
it's enough. I think it's enough.
Ordinarily, would you do it on both
If
sides?
it was a more chronic condition, if you had a pain for some weeks or months, I would have included the other side too. But as it had been operated yesterday, it's a very acute condition, so we can have it only in one side. Okay?
Thank you.
Fine. Thanks.
It's fine. I couldn't feel the force of the palpation.
What were you feeling before? How do you feel different than when you felt before?
The tooth was localized in its pain, and awareness of soreness. And I don't feel it too.
Are there any contraindications that is against using this?
Technique.
Yeah, or the use of the material? Are there any contraindications?
As long as you are sure that there is no allergy against cocaine. It's very seldom. And I've been told by doctors who are specialized only to have this neurotherapy. They have no other therapies. They are very monomane in this method. But they have thousands of patients, and if they use a very low percentage, they say again, also in allergy cases, it's really not so dangerous. 2 and 3% are the vasoconstricting agents. That is the worst, which gives a bad reaction. So if you are not sure with the patient, use physiological insulin 09 or homeopathic remedy. And I have learned from acupuncturists who have adopted my method that if they have done these injections in the mouth, in the wisdom tooth, premolar space, that they have better conditions all over the body. Same with this point. All other acupuncture points are more open, the actions are better, and complications are very seldom. Also circulation conditions are better. We don't know why, but I have the idea, inspired by Dr. Diamond and kinesiology, that especially this retromolar area is very much connected with our 2 parts of the hemispheres, right and left hemisphere. You know, the right and left hemisphere is like yin and yang again. The right hemisphere and the left hemisphere, they have to work together. For yin and yang is no against, but it's something to fit together, to work together. But it's 2 different parts, 2 different polarities. Man and wife is not the same, but they fit together. It's necessary to do and work together. And the same is with this yin and yang. This is left and the right brain. You know, the left brain is a brain we call the analytical, the mathematic side, where we do our rational, our mental work, all our thinking, all our planning, all that we realize, all that we are really active from our own ideas. That is the left side. And the right side is as important, but we don't realize that we also have to use the right side. The right side is quite another one. The right brain, you know, is a synthetic one, the intuitive one. That means you get the information as a whole, not by reading word for word or spelling a little word or what it is. It takes the whole. And this ability to take the whole is very important in medicine. I have learned that if the patient enters my room, I can either see him with this brain, with that brain, or with both. But normally we are taught in our medical studies and trainings, look at the patient, how does he walk, how does he, his posture, how is his face. Maybe there are typical signs for gastrical conditions or whatever it is, or you can see in the eyes what the colors are. I have learned the best is when the patient enters not to look with the right, with the left brain. I let him come and say the synthetic, the holistic view of the patient. The holistic view is to be, in a way, open for him. To be, in a way, not critical. For the left brain is a critical one. It's necessary to have it. It is necessary to be critical. But if he already critical when he enters, so we, in a way, we will not get the whole information. So I used to say we have 3 stages to look at the patient. The first is when he enters, to take him as a holistic person. To say, fine, there's some person I like. I have nothing I would regret, nothing I would reject. I take him in an open mind. And then when he's sitting in my stool, in the dentist chair, I have my my diagnosis. And the diagnosis is very necessary with the left brain. You have to be so critical. You have to hear all the arguments. You have to hear history, what is done before and what it is. We know it, we have it learned, it is our daily work. But when you begin again, or if you leave the patient, open again the other side. For it means, for example, if you hear a patient has a cancer, your left brain would say, oh, he will die in cancer, for cancer is nearly incurable. Your right brain would say, what it is, take it as it is. Maybe he is one of these who can survive. Your right brain again would say, chances very little. Your right brain would say, help him by a good idea, by good thoughts to overcome it. Is it? So give balance between both. Take him first when he enters with your open mind, right brain. When he sits in your stool, you're very exact scientific diagnosis with the left brain. And if you are finished and you do your work or you let him go, open again your right brain that you are really with all your heart with him. Is it? You go on or? It's no problem. You go on, yeah. Fine. So, Zurich is possible or not?
Well, just one thing. We're not going to have much more time. We're going to have a few more patients come in. We're going to possibly do some extraoral injection technique. But at this time, if you have any questions that you would want to ask now, so that Monday you can go in your practice and do it.
Very good.
So that you can feel comfortable enough that you can start using this technique, and then maybe in a few months we'll have a meeting among us. I'll contact you all so we can share our experiences and really work with the knowledge that we gain.
I would be very thankful if you give me all your questions now, so that when you come to your practice on Monday, that you have no problems to begin with.
Have you tried any of the electronic machines that issue a sound on an acupuncture on these points?
Very good question, thank you. For example, the full machine or all the other machines for bioelectrical measurements. If you use these points on the mucous membrane with its moisture, yeah, they don't work correct. They don't work correct. It's really our problem. And many of our colleagues ask me if I can't give it by an apparatus so correct as possible, I let it. But on the other hand, I have learned what I can do with my finger can be as well as with a machine. And if I train my finger, before I had begun with oral acupuncture and palpating in the oral cavity, I used machines at the auricle, machines at the skin, but now my fingers have been trained and so sensitive that they can feel the point, also here on the back side, here is the special points, the alarm points, what is the name, the more points where you are testing these points.
Alarm points.
Alarm points. So I think the chance for us to use more our fingers is a very good one. In German language, we have a word for treat. This word is behandeln. That means be handle it. Hand it. And many of my patients come and say, now I've been with 6 or 7 doctors, I was a neurologist, an orthopedist, an internal doctor, an X-ray and hospital, and that you are the first who put your hand on my body. And this is very often to hear. And I think that is the problem of our nowadays medicine. We have apparatus medicine, a mechanical medicine. We need it in many disciplines. I would never say that's not necessary, but our hand and our sensitivity, our right brain is as necessary. And we have again to train it so that it gets a holistic view in medicine again. Not that the other may disappear or may be rejected. 50-50, like our brain. We have our normal medicine, we are trained, but we could additionally do some other work and help the patient. Okay? But you can use the full method, for example, in a very fine way to find the focuses. For with oral acupuncture, you cannot diagnose focuses. As I have to learn and to stress this point, for many dentists in Germany ask me, yes, if we treat this point, would the focuses react, or would the focuses be diagnosed, or by the palpation, are you able to diagnose a focus, a dental focus? And I have to say no. It can be a side effect, as I told you, that the focus comes up again, reactivates, but it's not so often. Normally we cannot give a diagnosis by this palpation or by these injections. Huneke, 50 years ago, he suggested if you will control, if there is a dental focus, you have to inject all the area of all teeth in the upper and in the lower jaw, outside and inside in the vestibular fold. I have done with about 20 patients, and none of them came again in my practice. You know, if you would get injected from 8, 7, and so on, other side, it's the same again in this row, it's not to accept it for the patient. But therefore you can have the injections in this area which you will find at the patient. But now again to the question of follow. I think there are now possibilities to be trained in this whole technique. Dr. Kramer comes sometimes here to the States. He asks his colleague, and he has a wonderful technique. I have been his patient many years. And this is, you find special points, for example, in the outer face area. Points of the stomach meridian, points of the large intestine meridian, of the midline meridian, and you can have special measurements by these points, and you get some information, for example, about a special group of teeth, or a special tooth again. And this Voll machine has a scale, and when the scale is, when the yes, when this is a midline, it is okay. When it's more than the normal, it's a state of irritation, or what we can call inflammation, and it goes to the other side. It's too little in this special point, electrical energy, so it's the state of degeneration. That is a possibility we have, and so you can also find if there are focuses. And we have learned a very important reality to think of. Also in this area of the bone, of the alveolar processes, where teeth had been extracted many years ago, an empty space can be a focus. And we have it in many cases. If you have an X-ray, you don't find anything. X-ray says nothing. And if you control by the Voll machine, you find in many cases there is something. And then you can have a little operation, you open it, and you will find a very, very little area which is quite weak inside, and you can curate it, take it off, and you have done a fine operation, and many other troubles can be cured again. Focuses.
You can also stimulate an individual tooth and then test.
You can stimulate and test here by the lymphatic points.
Right.
This is a method now is more used. To control it by special points here on the thumb, the lymphatic points, the special points for the teeth. And I think if you are ready to learn it, it's wonderful. I know in Munich we have about 8 dentists now who are specialized so much on this method that they nearly only do this, but they have no more prosthetic and no more surgery because it takes so much time. You need more than 1 hour for such a measurement, and to say as it is, after this measurement, the doctor is very tired. Have you seen? Very tired.
Wear magnets around the
Yes, it's a method. If you do it, please do it very exact. It's necessary to be trained in many courses. Oral acupuncture you can learn in 1 course as we do today. The Voll technique is to be learned in about several hundred hours if you do it exact. And the other is that you have to change all your practice. You can say, I will no more have the other patients, I only do this. But if you would have this decision, you do a good work, not only for you and your patients, but for the other doctors. For I am very depending in Munich on these 8 dentists. for many of these cases which I cannot get with my oral acupuncture, with other acupuncture, with neurotherapy, I send to this dentist, and they really do perfect work. So in a big city like New York, for example, it would be very well if you had about 20 dentists who do this work, and you can send your patients there. And if some of you would train again here the others, Dr. Kramer will train you, and you train again the others. It would be perfect. Well, it's a good method. But again, if you have troubles, now we will not talk about the troubles, for example, the joints, the digestive troubles, or genital troubles. We have talked about you can cure it by oral points. We now go back to the special field of dentistry. Think of the afts. Think of the problems with the denture. I have learned by the German dentists that they told me, patients who have problems with the denture, they come again and again and again. Here it hurts, here it hurts, here it hurts. You begin sleeping. You do a little trim, a little first time, a little second time. Do not do it the third time. Before you do it the third time, for you know the denture is no more so good after so many work on it. Have a little bubble in this area. And if it is a little ulcer, do not inject in the ulcer, a little nearby or the other side. Again, you know the laws now, but have a treatment according to this oral acupuncture. And many of these problems disappear immediately. For it's not every time the denture that gives the pressure and causes a little ulcer or what it is, but in many cases it is a signal coming from inner organ functions and manifestating in the oral mucosa, and this is worse if in this area a denture is situated. For this denture gives a pressure on the point, a permanent pressure. But if you treat it, it's gone. So it can be caused by the denture, but it can as well be a signal which comes to a special point and can be better treated by this method. Both is possible. You have to give a chance for each method. What more?
The post-operative giving a bubble on the opposite side of where one has work. Is that?
Yeah. I remember when I worked as a dentist, we have the problem with the beginning pulpitis. A pulpitis that gives pain, sometimes cold and warm, and you begin and you have a very deep cavity, and you're very near the pulpa. And what to do? You have maybe calcium. There's a calcium
hydroxide.
Yeah, calcium hydroxide you put on it. In these cases, already 20 years ago when I was a dentist, I had a little injection in the cheeks. At that time I did it in the fold, in the vestibular fold. But the results are so much better. Give a little injection with a procaine or natrium saline in the fold, just out of this tooth.
On the opposite side?
Yeah, on the opposite side, procaine. And the results are so much better. The chance that the tooth will survive is so much better if you give this treatment.
Will that opposite side be sore on when you have an exposure on one side, or will that already be sore, or will you have to just locate it in approximate?
It depends. You can have your palpation, you can look what is better. It's very different. But this would, I will suggest you think of it, that such treatment can help such a lot. For in dentistry, we really have the problem that the pulpa is an organ we cannot influence, but it is innervated and musculated by such a little space as the root apex that we have no other chance to help as by changing the environmental conditions in the tissue and in the segments. And it's like the segment, you would treat the segment. And if you have a better reaction in all the segments, then the chance to overcome such a problem is better. Which if it is in surgery, if it's palpitis, in all these problems in dentistry, think of it, you can, in many cases, help your patient by little injections in the special field, that is buccally of the tooth, where the oral acupuncture points are situated, maybe sometimes also in the vestibular fold, why not? A little bubble is there. Or, as we told, in the other jaw, upper, lower, or the rule left, right, as we told the patients every day. Remember. So we have many ideas what you can realize of it. Some more questions?
I'm not too clear where between the upper and the lower is the TMJ points. You said
Yes.
between the upper and the lower,
Yes.
but I'm not clear.
The question is very important because I am asked very often of the dentists who are specialized for TMG treatments, signatologists, that they say what we do that is maybe caused by gynecological problems. And therefore I will give you once more the idea that we have many gynecological problems. It's true. And in many cases they may have been treated by a split, by a denture, and what you do. But think of it first to palpate. For many of the diagnoses in gynecology are not so clear. You find cases where you give this, where you do the split or whatever you do, because you have no other chance to do it. But if you first give the injection, you have to clear if it helps or not. And the muscles, the pterygic muscles, the internal and the external, they have own trigger points. There is a wonderful book that was published last year from Travel. And this Travel book has wonderful pictures about the trigger points in the pterygics. And you can treat the temporomandibular troubles by these trigger points as well. But I have looked at the pictures of Travel. These points he treated is not the same as the points I have demonstrated here. So you can treat with all acupuncture points, you can treat with the treble trigger points if necessary as well, before you begin with the split. For many cases it can be a muscle problem, but think of it, if it is a muscle problem, the muscle problem is a tension, a very hard tension, not only in the muscle, but the tension is in the person, but expresses itself most in the muscles. And this tension to overcome, there are many methods. We talked about yesterday with Dr. Diamond, these patients with lots of tensions. We can recommend them to have more movement, to have more sport. Then for motion and emotion is the same in a way. Motion is the somatic level of the emotions in the psychological level. You understand what I mean? If we have a very hard tension in our emotions, it will be as well in our motoric system, in our muscles. Reich, you know the name of Dr. Reich. He has talked about the frozen emotions in different levels. He called it, you know the name?
Of the body.
Yeah. He talked a lot about it. These are frozen emotions that we have. And to help our patients to get out them is on the one way he has to move, he sport or whatever it is, but you can help him by these injections in the retromolar space in the upper jaw, because this region again gives a balance between our different systems, between our yin and yang, our somatic and psychological systems, and so we have a kind of balance points. There are other balance points here you can learn from Dr. Diamond. He has found here points which are very important, acupuncture points, 2, gallbladder 20 area, but inside the mouth it is really a balanced area in the retromolar space of the upper jaw. With psychological conditions, with tension conditions, we have learned because a tension headache, you know the word tension headache. There are several kinds of headache, but the tension headache is, as many doctors now have confirmed, best treated by this area in the retromolar space, wisdom tooth area. And another problem to the wisdom teeth. The question what to do with the wisdom teeth. There are so many wisdom teeth that are totally impacted, half impacted, that have problems to come out, and you will find points in the area, and you can treat the points, but the problem is still there, for the tooth is impacted. And now the question is better to take the wisdom tooth or to keep it. And again, the answer is it depends on. if it is a severe problem. We have learned that the patient, for example, has a severe psychological condition or a psychiatric condition. It's very hard to say it because psychiatrists, they would not agree. But there's a doctor in Spain, a dentist in Spain, Adam, and he has done in 40 years, he came in my practice last year, he's 84 years old now, and he still doesn't work in Barcelona, near Barcelona. And he's a wonderful man. He has cured people with psychiatric conditions, with epilepsy and such conditions, by operating the wisdom teeth. So we have to realize that it is an energetic central area of the body.
You just had his book translated in English.
Is it translated in English?
Yes.
No. Wonderful. And if you have a chance to meet him, if you have a trip to Europe, go to Barcelona to meet him. He is such a funny man.
He's a monkey.
Yeah, he has lots of monkeys.
Yeah.
He is a funny man, and he is now so 84, 85 years old. Takes a chance to meet him. I will go there next year or this summer. I hope to meet him again. For we have to learn of such people. For he said that the wisdom tooth area is so important. You can treat it either by the points, and if you have good results, okay. But if the results are not good, or you have a very severe condition, and even if it is a psychiatric condition, you can have a try and have the wisdom teeth operated. But please don't talk to the patient and don't talk to the doctor or the psychiatrist what you do. Say it is necessary because of the teeth, but never of the illness, which is treated by other doctors too. I have learned I do it in my own responsibility. I cannot ask the neurologist or the other doctor, I do it. For if he is not engaged in this holistic view, and if he is not an Adler, or he wouldn't understand what we do. And again, if you have such a patient with chronic conditions, and you will operate this patient, look at the points and look at the conditions if he is in a good state to be operated. And if not, wait 2-3 weeks or 4 weeks, or have some treatments, for the state will be improved. Or wait till the patient maybe come back from a holiday. He will be in a better state to be operated. Such an operation for like a wisdom tooth, it's not necessary to be done in January. You can do it in March as well. Look at the patient, look at the season. There are seasons where the results of operation are very bad. You know it. There are no vitamins in the body and we are much more stressed, and so look at it. It's not necessary to do it at a special day. Control the situation of the patient and control the situation what is now just in the season or whatever it is. Some more questions?
Okay, we're going to have the next demonstration, and this is a very interesting young lady. She has, by age 20, she was a dentalist. This is now 15 years she's been a dentalist. A number of problems going around, and we figured this would be an interesting case. In addition, we'd like to, if it's appropriate, demonstrate a particular extraoral injection, which maybe Dr. Gleditsch could help with the aid of the skull, is extraorally, but essentially gets very close to the retromolar area also. She ready?
Just coming.
Okay, good.
One thing you didn't mention about that, is she also has a very bad shoulder.
She also has a very bad shoulder. So.
Shoulder, good. Shoulder, good.
Okay.
As well, good.
I have some more charts here. I will explain to you. Oh, fine. Hello. How are you?
This is Monica. This is dentists, your favorite friends.
Yeah, that's good.
Do you have photocopies of this one here? This is here. You will get one of these here, but it's in German. You have it in English now in the book. This is midline meridians. These who have learned with acupuncture know that there are midline meridian on the back, running all over the back, over the skull, over the nose, and the end of this meridian is inside at the frenulum of the upper jaw. And again, there is a midline meridian for going up here from the symphysis and going midline again, umbilicus, going up sternum, ugulum, chin, and again to the frenulum of the lower jaw. And in this picture, you see demonstrated that it may be that the energy flow, or whatever we call it, in the mouth is in connection with these 2 points. The energy of the midline meridians, the dorsal one and the ventral one, in a way is combined by our system of acupuncture points. For I can't imagine that it may end here and end there and finish. You know what I mean? In my idea, it has to be a circle. It has to be a circle. And this circle would explain to us a lot. It would also explain why the wisdom tooth and the retromolar space is so important, because the circle is closed at this area. Is it? So this picture may give you this idea. We can't prove it in any way. It's only an idea, but this idea is logical in my opinion. So that you can see what may be the base for our energy flow and our points within the oral cavity. And the other, this chart, again, we have the teeth and the points of the teeth, and this will demonstrate the mutual interplay between the groups of teeth, that they are meshed, as we have talked before. For example, that you can treat conditions in specific areas because 2 or different groups are meshed in this area. For example, the lower canine tooth. The lower canine tooth, according to acupuncture, is connected with liver gallbladder. But the next tooth nearby is the second one. And the second tooth is connected with kidney, bladder, according to acupuncture. And the fourth tooth is connected with stomach and spleen. And if we now look for the meridians crossing the knee, so we have liver, spleen, kidney, and outside gallbladder, stomach, and bladder on backside. 6 meridians again. So in the area, for example, of the canine tooth, in a very agglomerated area, all 6 meridians are concentrated again. And therefore it can be very helpful to treat knee troubles by this area of the canine tooth. So you understand that it's a point of meshing. Can we say mesh? Yeah, of meshing 6 different meridians. In normal acupuncture we know the low points, if you have learned about these points. And it's some similar system. So you will get one of these charts, and I think the informations are very simple to get it. It's only to understand that they are meshed and why we can, for example, treat sinus conditions here and this there. But think of it, the retromolar conditions are not in the chart, and they are the superior. The patient again, please.
To be here.